If you're researching Ozempic and wondering whether you should take the oral version or the injectable version, there's something important you need to know before making your decision. Most people searching for this information don't realize they're actually asking the wrong question, and it's costing them money and confusion. So in this video, I'm going to clear up the biggest misconception about oral Ozempic, show you what actually is available, and help you figure out which option is right for you. Let's start with Ozempic. Ozempic is a brand name medication. It contains the active ingredient semaglutide, which is a GLP-1 receptor agonist for blood sugar control and weight loss. Here's the key point that often gets misunderstood. Ozempic only comes as an injectable pen. There is no oral version of Ozempic. If you ever see something advertised as oral Ozempic, that's not accurate. When people assume an oral version of Ozempic exists, they can end up with unrealistic expectations, confusion about effectiveness, or unexpected costs. Now let's talk about compounded semaglutide. Compounded semaglutide contains the same active ingredient as Ozempic, semaglutide. The main difference is how it's made. Instead of being manufactured by a large pharmaceutical company, it's prepared by FDA-registered pharmacies in the United States. These pharmacies are legally allowed to compound medications when appropriate, especially when patients need alternative dosages, formats, or affordability options. But what does compounded actually mean? Compounding is the process of custom making a medication for an individual patient under the supervision of a licensed pharmacist. Compounding pharmacies can adjust things like their dosage strength, formulation, or delivery methods. Compounded semaglutide can also be combined with other compatible medications depending on the patient's needs. For example, pharmacies might combine semaglutide with stabilizers or preservatives to keep the medicine safe and effective, or flavoring agents in oral formulations. These combinations are made carefully to ensure stability, safety, and effectiveness, and are always regulated by the FDA for quality standards. Another main difference is compounded semaglutide is available in both injectable and oral forms, depending on the pharmacy and formulation. Cost is also a big reason why people start asking questions. Branded Ozempic typically costs between $900 and $1,500 per month without insurance. In contrast, compounded semaglutide usually ranges from about $179 to $349 per month, depending on dosage and whether it's oral or injectable. That price difference exists because you're paying brand manufacturing, marketing, and patents with Ozempic versus pharmacy compounding with generic ingredients. If you're trying to decide between oral and injectable, TrimRx offers both compounded semaglutide options, so you can choose what fits your lifestyle best. Complete a free assessment and discuss with a licensed provider which form is right for you. First link in the description to see if you qualify. Now back to the video. Today, we're breaking down how each works, the pros, the cons, and the research showing the effectiveness. Let's start with oral semaglutide. This is a daily pill taken in the morning and on an empty stomach with about 4 ounces of water. After taking it, you need to wait at least 30 minutes before eating, drinking, or taking other medications. This can be inconvenient for people with busy mornings or complex medication schedules, and missing this timing window can reduce how well the medication works. Some benefits of the oral form include no needles, which makes it less intimidating for first-time users, convenient daily routine that fits into a morning habit. It eliminates injection anxiety entirely. However, there are some trade-offs: the strict timing requirements. It must be taken on an empty stomach and with water only. Lower absorption compared to injectable semaglutide. Because the digestive system breaks down some of the drug before it enters the bloodstream, oral semaglutide doesn't reach the same peak levels in your body as the injectable form. It requires daily commitment rather than weekly dosing. This daily routine can feel burdensome, and for some people, it increases the chances of a missed dose. Now let's look at the injectable semaglutide. This is a once-weekly injection into fatty tissue, usually around the stomach or thigh, and the injection itself only takes about 30 seconds. Because the medication is injected under the skin, it bypasses the digestive system. This allows nearly all of the medication to enter your bloodstream, making its effects more reliable and consistent. Advantages of the injectable form include higher absorption rates, meaning more predictable effects, once weekly convenience rather than daily dosing. Many people find this far simpler than remembering to take a pill every single day. No food timing restrictions. You can take it at a time that fits your schedule without having to plan your meals around it. Most clinical studies and long-term data use the injectable form. The downsides include it requires self-injection, which can be intimidating at first. Learning to self-inject takes a little practice, and initial nervousness is normal. It must be stored in the refrigerator. There's a slight learning curve for the proper technique. Most people can get the hang of it quickly with guidance from a healthcare provider or a nurse, and instructional materials are widely available. When it comes to weight loss, both oral and injectable semaglutide are effective. Oral semaglutide works, but absorption can vary from person to person, which can affect results. This is because the medicine has to survive the digestive system before it enters bloodstream. Several factors can affect how much of the pill is absorbed. Some factors are timing with other medications, water intake, or stomach acidity. On the other hand, injectable semaglutide tends to be more predictable. It bypasses the digestive system. Absorption is more reliable, which helps the medication work as intended with fewer variables. It also benefits from a larger body of clinical research and long-term data, with clinical studies showing an average weight loss of 14 to 20% over several months when combined with diet and exercise. This makes the injectable version ideal for people who prioritize maximum effectiveness and consistency over the convenience of a needle-free option. In short, oral semaglutide is convenient for those who want to avoid needles, but requires strict timing and daily commitment. Injectable semaglutide is more predictable, supported by the most clinical data, and only requires weekly injection, though it comes with a slight learning curve. But which one is right for you? Today, we'll break down who benefits most from each form, how TrimRx makes both options available, and what the research says about effectiveness. If you're uncomfortable with needles but are disciplined about taking a pill every morning and following timing rules, the oral form can fit seamlessly into your routine. The key is consistency and attention to timing, because skipping or mistiming a dose can reduce the effectiveness of the medication. Injectable semaglutide is generally more predictable, with higher absorption and more clinical data supporting its use, making it ideal for those who prioritize effectiveness over the needle-free convenience. TrimRx supports both oral and injectable semaglutide. The options are the daily pill or injectable for $299 a month, or as low as $179 a month when bundled in a multi-month package. What makes TrimRx so unique is that you're not left to figure out semaglutide on your own. A licensed healthcare provider works with you to evaluate your lifestyle, daily routine, and health goals to help you choose the form of semaglutide, oral or injectable, that's the best fit. They take into account factors like how comfortable you are with needles, how consistent you are with taking daily medications, your schedule, your treatment objectives. What's more, TrimRx is flexible. You're not locked into your initial choice. If you start with one form and later find that it isn't the right fit, for example, if daily pills feel burdensome or if the injections are easier than expected, you can switch forms under the guidance of your provider. This ensures you stay on track with your treatment safely and effectively, without needing to restart or guess on your own. This approach means you get personalized support, flexibility, and guidance, rather than a one-size-fits-all plan. The program is designed to adapt to your needs, making it easier to stay consistent, to see results, and feel confident in your treatment decisions. Let's address the question many people ask: which is better? Injectable semaglutide has better absorption and more predictable results. Oral semaglutide also works, but absorption can vary based on factors we were discussing earlier. When it comes to semaglutide, the most important factor isn't which form is technically stronger or more absorbed. It's which form you're most likely to take consistently. Even the most effective medication won't work if doses are missed or not taken correctly. For example, oral semaglutide can be highly effective, but it requires daily attention, empty stomach timing, and water before food. Someone who struggles to maintain that routine might miss doses or take it incorrectly, which can reduce effectiveness. Injectable semaglutide is taken once a week, which can make it easier for some people to stay on track. However, some individuals may feel anxious about needles and might avoid injections, leading to missed doses. The key is choosing the form form that fits your daily habits, lifestyle, and comfort level. The medication you take consistently, every day or every week as prescribed, is the one that will give you the best results. I know we talked about a lot of things today, so let's do a quick recap. There's no oral version of branded Ozempic, but compounded semaglutide is available in both oral and injectable forms. The oral version is taken daily on an empty stomach and is ideal for people who want to avoid needles, while the injectable is taken once a week and provides higher absorption for more consistent results. Both forms are legitimate medical treatments, and TrimRx offers both options, so you can choose the one that fits your lifestyle. Click the first link in the description to complete your free assessment and speak with a licensed provider about which option is right for you.